And, and I'm very excited to share with you a brief history of services based on applied behavior analysis in Bahrain. And I'm just looking for, which I thought I opened up in advance. I'm so sorry.
No worries. While Miss Ingy pulls up her...
there we go.
Very good. Excellent.
Okay. So over the past 15 years, the ecosystem for autism services in Bahrain has evolved, definitely not as fast as one would have hoped, but there is a clear redirection towards evidence-based practice and a rise in the availability of interventions based on the science of applied behavior analysis. Now, just like other countries in the region, there are definite blocks in the road that are slowing this process down, I think unnecessarily. And one of those is just the stagnation of our regulatory bodies and the speed at which they move and process new information and new professional fields. And that is one of the biggest, I think, blocks in the road to moving faster. If we look briefly at a timeline, in 2003, the ABAI delegation presented a comprehensive introduction to ABA at the Middle East Applied Behavior Analysis Conference, which was held in Bahrain. So in many ways, I think Bahrain, although very little, is a trailblazer in many ways, and but it's a trailblazer, but not enough momentum happens to bring change as fast as we would hope. In 2014, an organization called Bahrain Society for Children with Behavior and Communication Disorders set up a therapy intervention center called Alia for Early Intervention. They, I believe, were the first organization in Bahrain to provide services based on applied behavior analysis at scale. So in a way, they were sort of filling the deficit with regards to government organizations in providing evidence-based therapies. And they, although not a government organization, picked up a lot of the slack and were accepting a huge amount of children. And they still run, they still run a waiting list in the hundreds, because it is a place where the cost is kept to a minimum and the services are provided to families along with training. So they have, I believe, contracted with offsite remote program supervisors and creators. But in 2006, there was the first Bahraini board certified analyst, and that's me. And I'm happy to say since then there are more, but it took a while. 2012, we had the first center with on-site BCBAs in Bahrain. 2017, a charitable organization called Umniyat was set up specifically for the purpose of moving along things with regards to dissemination of information, parent awareness, facilitating credentialing of ABA professionals in Bahrain. In 2020, another milestone was the first center in the Middle East and North Africa was accredited at the highest level by the Behavioral Health Center of Excellence. And that again was Bahrain, it was Think. So all of these milestones, I feel, have contributed towards creating an ecosystem that acknowledges standards, acknowledges professional accreditation, acknowledges metrics required for quality of care and maintaining standards of quality of care. Now, I think the most important metric is how many certified professionals are there in this space. With regards to BCBAs in Bahrain, the numbers have improved from 2006, but again, you can see very, very slow changes. And still a small number of professionals. But what is encouraging is that the percentage of those professionals that are Bahraini are increasing and is increasing. And I think that will contribute to more organic and long-lasting change. So in other countries in the region, you may have much bigger numbers, but my question would be, how many of those are from the local community? How many of them are nationals? How many of them are invested long-term there, not just taking, jobs and are transient? And I think that will have an impact on, what future developments happen for that country in the space of services based on applied behavior analysis. Now, in order to get these numbers, it wasn't just possible to go into, the board website and see, but because Bahrain is such a small space, we literally know everybody who's come through and has left and what day they came and where they worked and when they left. So it was really nice that we could, because of our size, we could come up with this data. The same for RBTs. The number of locals, Bahraini RBTs in Bahrain is increasing. I don't know if this has helped or harmed us in terms of the whole RBT certification. There's a lot of debate locally. Has this misled families as to the scope that these professionals are able to practice within? We don't have any, as you'll see from subsequent slides, we don't have any regulators. And so what these professionals claim they can do is taken at face value by a lot of families. So like Dr. Ruqayya was saying, a lot of work has to be done on the back end to make sure that the marketing noise is pierced through with some facts and awareness and linking family to reliable sources of information. Like you can, as you can do your due diligence as a consumer, you can go and see what these people are licensed to practice and are not licensed to practice. But it is, it's a process, and it takes a long time for a family. You're overwhelmed with terminology. You're trying to understand your role in this science and how it relates to your family, and how you're preoccupied with just getting your kid to learn skills. You're not really listening when people are talking to you about, listen, this is this credential, they can only do this, don't go to this person. So that's, I think, everybody, it's a challenge for everybody. Now, in 2015, there were 4 centers that advertised that they were providing services based on applied behavior analysis. Of those 4 centers, only 1 had on-site BCBAs. And in 2021, so it's just a snapshot at that time, and then a snapshot in 2021, is that there are 12 centers now, more or less, that advertise services based on ABA, and 3 of them have on-site supervision. Now, I cannot speak to the ratio of supervision per hour of therapy, so I don't know if they're meeting those standards. I just know that they have a person who is a BCBA on site, at minimum a person. What is the state of affairs with local standards and regulations? It's not encouraging at this point in time, but at the moment, the Ministry of Social Welfare regulates rehabilitation centers, and there isn't any sort of, there's no metrics to distinguish quality of services amongst the centers, right? Now, for allied health professionals, there is the National Health Regulatory Authority, the NHRA. So that would cover speech and language therapists, psychologists, occupational therapists, and physiotherapists. And with regards to, so there's nothing for behavior analysis. It's not acknowledged, right? It's not acknowledged as a separate field of practice. It's acknowledged as a division under psychology, but not even documented that way. So it's spoken about. When I spoke to the professionals at this regulatory body, they said it's a division under psychology and any psychologist can practice it, and it doesn't require further regulation. Now, which leads us to, so what is the definition of a psychologist according to the NHRA? They have to have a bachelor's degree in psychology to practice, or a bachelor's degree in education and a master's degree in psychology. How does this differ? And I was very interested to hear Sharifa's talk because there's, the Abu Dhabi board deciding on their standards, which in a way are more intensive than the board standards, because they're requiring you to have your degree, all of your degrees in behavior analysis, whereas the board doesn't require that. You can have associated fields. But just looking at Bahrain, so if behavior analysis falls under psychology, these are the requirements. And the discipline titles underneath that, behavior analysis is not mentioned. So it's really absent from the, even from the conceptual level of practice within our regulatory framework in Bahrain. The Dubai Health Center regulations, I think, have taken their standards very much from the board. So the degrees are allowed in related fields, and the clinical experience and is very much in line with the board standards. So what has been done in terms of, since, out of the regulatory space, what has been done in terms of awareness and advocacy, which is where we all find ourselves when we're trying to move things ahead in a system where the bureaucracy is not maybe responsive to the field, to the needs of families, etc. So as I mentioned earlier, the Bahrain Society for Children with Behavioral and Communication Difficulties was set up and provided the first widespread availability of services based on applied behavior analysis. Fast forward to 2019, or 2018, I'm sorry, the Umniyat was established to move things further ahead. And one of those main things was there are no professionals available. And if we can't preach that we want quality of care and BCBA supervision in all of these centers if we don't have a way to facilitate creating more BCBAs for these centers. So we spoke to a fund called Temkeen that supports professional training for locals, and we convinced them to add the BCBA certification as one of their supported programs. That was huge, and then COVID hit. And then there's been a little bit of stagnation in that area, but we hope to revive it. The next step is to continue to have discussions with the NHRA and to add behavior analysts as a separate allied health profession. And this is not easy. This discussion is not going to happen from one BCBA. It has to be a group of us invested in developing the ecosystem in Bahrain. And as there are more and more Bahraini BCBAs, I think that will slowly but surely happen. So we've done, as Umniyat has also done a lot of partnerships with regional experts in ABA to provide more talks, more free access to quality workshops, because we feel that the strategy of educating and empowering families is what's going to create the momentum for change in Bahrain. With regards to more widespread acceptance of the field, more widespread acknowledgement of the outcome measures of this field. And just like Dr. Ruqayya was saying, the way we're able to maybe litmus test how our efforts are working is in 2020, for the first time, the Bahrain Autistic Society endorsed services based on applied behavior analysis publicly. And they also asserted the importance of having certified professionals. This was not the tone, I would say, a year ago at all. So, that strategy of partnering with existing organizations is always key, because you get more people invested in your mission, and they can share the glory and they can share whatever it is that, that keeps people going. But I think those partnerships, that's a strategy that has really, really proved successful. So moving ahead to gaps, we still don't have a degree program in Bahrain or a verified course sequence in applied behavior analysis. That's not from not trying. We did approach Bahrain Teachers College because we wanted a public university to take on this mission. And, you know, it wasn't, at the time, it didn't happen. It wasn't, you know, it wasn't something that was going to go ahead. We still need to keep pushing in that area. And mainly because employment opportunities are massive. And that was our angle when we were, you know, promoting the need for this degree program, is that, you know, and explaining that the average income of a education graduate, even a special education graduate, can expand exponentially if you add to it, you know, certification. So I think that piqued their interest, but not enough so to establish a department. Another thing is which board, you know, now where are we going to go? We don't have a local board. We don't have a regional board for behavior analysis. I'm very interested in learning about the Saudi board that will be established, the efforts in the UAE, and how that can impact us potentially. Maybe we can, you know, I would think sort of be placed under one of the more established boards before a board is established in Bahrain. But in the meantime, what international regulator is going to cover the new certificates that are coming out? That's important. And that's a conversation we need to start having with stakeholders, with families, with, you know, the like Tamkeen Fund that is pushing for professionals to get credentialed. Who's going to regulate them after they're credentialed? And there are efforts at the moment by a behavior analyst called Fawzia Kiwan in Bahrain to establish an ABAI chapter there. So let's see what happens, and let's hope that the progress is a little bit more, you know, it moves at a more efficient pace than it has previously. That's my brief chat, and thank you for the opportunity.
Thank you.